Today in this video, we're going to talk about a unique medicine in Ayurveda that is known to promote speech. Kids with autism, kids with ADHD, kids with slur speech, no speech. This is a unique medicine that has wonderful results when it comes to promoting speech. Kids with delayed milestone, this is a unique medicine with lots of benefits. Not just kids, but those patients with paralysis, tremors, Parkinson, degenerating disorders, demyelinating disorders, this is one of the best medicine. I'll be discussing medicine, its properties, its unique usage. We call it Jiva Lepan, which is external paste over the tongue that helps in promoting the speech. In detail video to help kids with autism, ADHD, delayed milestone, speech, clear speech, Shabda Spashtata, we call it in Ayurveda. Let's understand in this video. First everyone, welcome to Jyovis Hospital of Ayurveda and Aesthetic Center, Mumbai. We're talking about the root which is Akarkara, commonly known as acyclis, commonly known as Anacyclis pyrethrum. Talking about its properties, it is pungent, it is dry, it is tikshna, it is very much piercing. So it is hot, it is ushnavirya, it is piercing. So the right dose is very, very important. I'll be telling you also about the precautions that you need to take and the unique method of how you got to use it to reap all the benefit it offers. Talking about Akarkara, it has a prabhav, it has a special effect which is Nadi Uttejak, which is stimulating the nerves. For motor neuron disorders, for neuromuscular disorders, for myasthenia gravis, this is a wonderful, wonderful medicine. It stimulates the overall nerves. So whether it is lack of blood flow towards the sexual organs, whether it is clybia, which is male sexual disorder, whether it is female sexual disorder, whether it is Parkinson, tremors, demyelinating disorders, wherever nerves play a role, Akarkara plays a huge role. So Akarkara is known to stimulate the nerves, it gives strength to the nerves. So right from sciatic issues to cervical spondylosis where people have tingling, numbness, lack, like neuropathy, peripheral neuropathy, diabetic neuropathy, this is a unique medicine. You all are watching this video because you want to know about kids and for their speech. So let me talk about kids and speech. Akarkara, we saw it's a unique medicine which is sharp and hot. So we're going to talk about this. It is sharp, so we either use it as a single herb which has a good result, or we make it mild by combining 2 more herbs along with it. So depending if the patient we get which is of child of Pitta Prakruti, we will use a combination of 3. If we as a Vaidya see a child of Vatkaf Prakruti, we'll just use a single medicine which is Akarkara, which has again wonderful result because it is known to stimulate the nerves. In Ayurveda, it is said the action of the medicine starts from the tongue. The moment the tongue feels the medicine, the brain gets the signal. Many times what we do is the moment we use the medicine orally, a similar oil and grita we use in the form of nasya. So the frontal pressure in the brain, which is autism, which is ADHD, reduces. Kids become cool and calm. Their aggression reduces and we see tremendous amount of change, positive change in kids with severe cases of autism and ADHD. So what do I mean to say is that the action starts the moment the medicine reaches the tongue. And here we're doing a Jiva Lepan, which is application over the tongue and the palate. How? Let's understand. So if patient is of Pitta Prakruti, we will use Akarkara. We will combine it with Jeshti Madhu, which is Glyceria glabra, and the third one which is Vacant, which is Vacha, which is Ecormus ecalamus. So we will use Vacha, Yashni Madhu, Akarkara in combination in equal amount, which is a safe medicine. A stronger version to this is Akarkara. So take root powder, a pinch of root powder, half or 1/4 of the root powder. Use your ring finger, mix honey into it, make a paste out of it, make a thick paste, and take this particular medicine and rub it over the tongue and the palate area for a minimum of 30 to 45 seconds. If not, then at least you should start with 5 to 10 seconds. It is advised to use this medicine at least 3 to 4 times in a day. 4 times a day is good to go. A minimum 2 times is very, very good to start with. So to do 4 times a day, external application, tongue and palate. This is how you use it. Even if kids gulp it, it's okay. It's even safe for those with 1 year age, 2-year-old, 3-year-old to someone with 16-year-old. We use it for people, patients, old age, for even 75, 80 years of Parkinson. So it is an absolutely safe medicine. It's always recommended to use any Ayurveda medicine, especially stimulants like Akarkara, under classical Ayurveda doctors' observation and supervision. So Akarkara is wonderful. It is beneficial for male sexual disorders as well, for stimulation as well, for erectile dysfunction as well. Akarkara, this root powder, around 5 gram, is mixed with 60 ml of coconut oil. It is kept in sunlight for 6 to 8 days and then it is filtered and is used for external application. It is used for those who get a lot of tingling, a lot of neuropathic issues, a lot of neuropathic cramps. For patients of grudrasi, which is sciatic, a patient starts walking like gridra, vulture, bird. So for these people, this is an amazing painkiller. Akarkara is known to reduce toothaches. Come on, if there is a toothache, just take a root powder of Akarkara, mix it with khadir and mix it in an equal amount and keep that pinch over the toothache area, and in a fraction of seconds we experience that the toothache comes down. It is an excellent antioxidant. There is a research on Akarkara with regards to its anti-Alzheimer enzyme activity. So for prevention of Alzheimer, for treating cases, for management of Alzheimer, dementia, we see a lot of benefits of Akarkara. Why am I talking about dementia? Because people with motor neuron disorders, especially those with ALS, amyotrophic lateral sclerosis, ALS, a common type of motor neuron disease, we see that motor neuron disorders tend to also affect the age, the lifespan, and then it affects and the patient may land into dementia. So it is a progressive muscular dystrophy, a progressive degenerating disorder. To stop that progression, a wonderful strong stimulant, Ushna Tikshna antioxidant medicine like Akarkara, when used orally, when used externally, has miraculous results. So this is about Akarkara. Any doubts, questions, please do let us know in the comment section below. We're open to your questions. Let us know your doubts. Until next time, I'm Dr. Raj Satpute from Jyovis and the team. Look impressive, be progressive.